How is everybody doing? And welcome back for another Strength Chat episode. Today, I've got a very special guest for you all. He's a doctor of physical therapy, a specialist in orthopedic physical therapy, and he's also a certified strength and conditioning specialist. Today, I am joined by the one and only Caleb Burgess. How are you doing?
I'm doing great. How are you?
I'm very well, thank you. Thanks a lot for taking the time to jump on. But I suppose the first question is, what's been happening in your world recently? What have you been up to?
We are just preparing for a lot of summer activities with the kids.
Nice.
So nothing too crazy on the professional end, just kind of working with my clients and managing my app and making content like I normally do. But it's more about family stuff at this stage of life with my 3 and 5 year old boys.
Yeah, definitely. Especially, I think it's good to have that balance between work and life, which I think sometimes can sometimes get lost sometimes. Um, I've just done a quite a brief introduction, mainly kind of the end product, if you like, of where you're at now in terms of your experience, if you like. But for everyone listening who might not know your background in training, education, basically, getting to the point where you're at now, just want to give a little bit of a background to yourself, Caleb.
Sure. Yeah, so I did 4 years undergrad, which was like kind of like a pre-physical therapy degree. And then I took like a couple months off just because that was what the start time for the graduate school for physical therapy was, which was kind of nice to kind of reset my batteries. And then went into physical therapy school for 3 years, and then after that went straight into working. And what I did was I did a residency program for orthopedic physical therapy, which is basically a year of really diving into orthopedic physical therapy with courses on the weekends after you do your normal working. You have mentoring every week. So as you're working with patients, you actually have somebody who has like 20 plus years of experience. I mean, some of the mentors don't have as much experience as 20 plus years. That's just my mentor had a lot of experience. So it was kind of cool to um, well, it wasn't cool in the moment, but you're basically getting grilled about what you could have done better, what you did well. You did a lot of self-reflection. And then you end up basically taking an exam to become an orthopedic clinical specialist. And then the next year after that, I did it was a sports and orthopedic manual physical therapy fellowship. So that's basically like after you have that specialty as a orthopedic clinical specialist, you basically can go into sports. And also, we got a lot of hands-on training, which is hilarious because now I do only online. But but basically, I got the training to do that for an additional year. And then after that, I just went into working in kind of like a sports orthopedic setting for a few years. And then I started making content, and that turned into seeing people virtually. And then maybe 3 or 4 years after that, I ended up transitioning to part-time because I was doing so much virtually. And then now I'm 100% virtual. And I've been doing 100% virtual since around this time, 2023. So like the last 3 years. Yeah.
Ah, cool. And was that kind of um, always the goal in terms of transitioning to online, or was it something that kind of happened naturally? How did that, how did you even find that transition after, working so long in person with clients?
Yeah, it was not something that I planned on. I planned on kind of, I actually originally wanted to do like teaching to students like coming up as physical therapists, and then I wanted to um, basically I wanted to potentially teach in a residency or fellowship myself, or at least help out and mentor. Um, but it was kind of like a loose plan. I was just kind of trying to find other ways to pique my interest or help more people. So it turned into first making content because it was kind of like a fun side thing to do to get more people to learn about what we do and how we can help. And then that turned into, oh, I can actually turn this into part of my profession where I can make an income doing this, or at least part-time income. And then it just kind of exploded enough that it just made sense to with a young family. It was a lot easier to spend more time with my kids. I think eventually I want to go back to doing some in-person stuff again, part-time, where I can kind of do like a half and half sort of thing as the kids get a little older. But at this stage of my life, it really works well. So I just kind of stuck with this for now.
Yeah. Oh, cool. And I think this kind of goes nicely into the first topic that I had in mind. And this was something that you shared not so long ago, kind of about um, black and white statements when working with clients, working with people who have had injuries. And because you've had that experience of, working with people in person, working with people virtually, but then also creating content. And I'm sure it'd be interesting to hear your thoughts, in a minute reel that you put on social media or anything like that. It's got to grab people's interest. But you read a little bit further, there's more to it than that. So I suppose the first question is, what is kind of your experience of black and white statements within, physical therapy, working with clients, and how can that impact the client, both maybe positively and negatively, if that kind of makes sense, Caleb?
Yeah, I'm not going to do too specific, but I mean, we've probably all seen things in the fitness and physical therapy world on social media where there's these very strong statements of like, if you do this, it will do this thing, or if you do this one thing, it'll solve all your problems, or all that kind of stuff. Or anybody who says this is wrong because this is actually the right thing. I guess the positive of that, if I could glean a positive, is that it draws people in. People are much more willing to stop and listen to somebody who has a very definitive black and white statement. So if it reaches the right people who that is very specific for, that whatever, I don't know, exercise or advice that is referring to, then they might get benefit from it. And it's good that they stopped on that because they got benefit from it. I guess that's the positive. But I think the negatives probably, not probably, they do outweigh the positives, because what's going to happen is there's going to be countless people who stop and watch that, and there's no nuance provided anywhere. And so it's not going to work for them or make them feel worse, whatever issue they're dealing with, or it's not going to help them with whatever fitness goals they have. And then, so not only is that going to be like a negative for them, but also then they're going to kind of feel like, well, that person said this was going to help. Like, now what do I do? And they're going to keep looking for definitive statements and other things that they do. The nuance stuff, it's difficult. This is not necessarily your question, but it's kind of I guess, building off of that. Providing more nuance is not usually going to get as many eyeballs to stop on it because it's not as definitive. It's not as like eye catching. It's not as like, oh, that's speaking to me specifically. So there is a skill in trying to get people to stop and watch your content when there's so much out there. But also making sure that you tie in some nuance there, either within the post itself, sometimes within the caption, if you're talking about like Instagram, like, hey, make sure you read the caption, or have something where people can read down and go, okay, this might not be appropriate for everybody. These are just examples. And that's what I talk about all the time is like when I do make content that's a little bit more, it's not necessarily black and white, but it's a little bit more like, hey, do this thing because it typically helps with this thing. I will always say to people like, hey, by the way, this is just examples. This will help a lot of people with this sort of subset if you match these criteria. But it's not going to be 100% perfect for everybody. That's why you should get an assessment and work with somebody individually if you really want to make sure that it's tailored to you. And just
Yeah.
making sure that people know that and they go, hey, this might help you, and I'm glad if it does. But if it doesn't, like, don't freak out. It's okay. Like, this is just I'm just giving like general advice from like populations of people that I work with that I have seen these patterns.
Yeah, definitely. I think what the key thing that you said there was, patterns, usually you're going to find the same things, especially from your experience of working in person. I know for myself as a coach, if you are seeing people move quite a lot, it's kind of like you have more data points to make a better judgment call on maybe it's going to be this. Obviously, like what you said there, having the assessment is going to make it specific to that person because everyone's going to be different, maybe have different symptoms or how they respond to things. And I know you said there about And you kind of said it at the start, wanting to be able to help more people and putting content out there. Generally, if people do those things, it's probably going to be better than them not doing anything at all. It's going to help them step in the right direction. But from kind of both sides of from the therapist side and then the client side, do you think that it's a case of people looking for this exact answer as opposed to it being, well, actually, there may be a couple more variables that we need to take into account to help with this. And there may be bypassing that little bit more in-depth assessment and just kind of, oh, well, I've seen this exercise. This sounds similar to what I've got. I'm just going to do this. Does that kind of make sense?
Yeah, I think people want to feel like they are 100% guaranteed of an outcome. And so when somebody presents it that way, it's comforting because it's like, oh, okay, like there's no mess, there's no gray area here. This is just black and white. This is what's going to happen. If I do this, this will happen. And unfortunately, that is not the case. As we know, when you're working with people with movement or aches and pains or different genetics, all that stuff plays into it. And so I think helping people understand that we have these pattern recognition, or we have this pattern recognition that we've figured out with different clientele and groups of people. But also understanding that, like, hey, I always tell people like if there's I always give the example of like if I had 10 different people with the exact same problem that they wanted solved, even if they had the exact or what seems like the exact same pattern, there's always little nuances and variability of what I will give that person depending on their specific goals or again their genetics or their past injury history or that their past training history. And there's so many things that will, if you line up all those 10 programs together, they might look very similar in a lot of ways. There might be a lot of similar exercises, there are similar cues, or similar advice, but there's never going to be an exact blueprint, exact same thing for each person. Again, me saying this, I have programs that I've made that I have like in an app where, again, I made them for like, hey, maybe 80% of people will get a lot of benefit from this. It's not going to be perfect for any one person, but 80% of people will have a lot of benefit. There's another 20% that might think they fit this criteria, but it's just not appropriate for them at all. I can't know that, but I always kind of give a disclaimer, like just so you guys know, like this is kind of like step one. If you want to try this and you don't feel like something that's more individualized, but if you try this and you're maybe getting some help, but you need more, or maybe it didn't help you at all, to what you thought it would, that's where you need to kind of invest more of your time and potentially your money into working with somebody more individually.
Yeah.
So
And you've mentioned a couple of times there of this might not work for everybody. If you've had these symptoms, this will help. And kind of two things that were going around my head there is you and like what you mentioned about putting a little bit more information in the caption or how you're explaining it to people that you're working with. It's kind of clear that you want to be clear with how you're communicating rather than yes, it might say like do these exercises to help with X, Y, and Z. But there's then something like what we said at the start, something a little bit deeper of, well, actually, this might not work for you. The second part of that is other people will always, and it'd be interesting to hear your thoughts on this as well, is somebody always has like a friend or somebody that they know that, well, they did this, they had a similar thing to me and they did this and it worked for them. So I must do the same thing. How do you kind of um make sure that you're using the right language, being clear with the clients that you're working with, and also making the client understand that, look, yes, you both might have bad backs, for example, but there's these variables that were influencing this person. You need something either more in depth or slightly different, or you don't need as much as this person. How do you kind of make sure that you're being clear, communicating it so there aren't any crossed wires or it's kind of like this is gospel, this is exactly what you need to do, this just listen to me.
I think just kind of what you said is like I will if they say something like, well, so and so had this, I usually try to empathize with them of like, oh, I understand why you feel like you need this, or I understand why that concerns you because your uncle had this issue or your dad had this issue or your mom, whatever. Um, However, I always explain to them like, okay, well, let's break this down a bit. and it kind of depends on how well they know that person too. If they know that person pretty well and they know kind of their history of their life or what they've done or whatever, their injuries, and I will kind of start having them tell me like, okay, well, what happened? What other things are going on in their life or happened in their life compared to you? And okay, like, do you remember what they were presenting like? Like, were they were like walking around where they could barely move or barely get out of bed? Like, are you in that situation? And like, and kind of put that back on them of thinking about that and reflecting of like, okay, are you in that same situation, even though you might have the same area of symptoms or same what seems like the same issue, maybe it's a lot more different than you realize. So kind of having them self-reflect on that, it's a little bit more different when it's a little bit different when the person that they are talking about maybe they don't know much at all. So there's a lot more like they don't know anything about that person. So they're kind of like, well, that person said this. Um, and then I guess in those situations, what I'll tell the person is like, well, you don't really know all of the other things going on with them or that background history. So you can't really compare yourself to them because you don't know anything about them. Whereas if they do know enough, I can kind of help them reflect on how it's different than their situation and find all the things that are actually different. There might be similarities, but I find all the things that are actually different so that they understand, like, oh, just because they said that this is a thing that I should do doesn't necessarily think that that's doesn't mean that's correct for me, and it makes more sense as they start to outline all the differences.
Yeah. And do you think that's because especially when it comes to, injuries, pain, people just want to get it fixed. They just want to be out of pain and be able to go back to what they're doing for. Do you think, using other people that they know as examples or, trying to find, that one exercise or that one thing that's just going to get them out of it, they're looking for that one thing just because they want an answer and they just want that result to be, wake up tomorrow and be like, cool, I don't have a bad back anymore. I can just
Yeah.
I can just go from there. And that's why they maybe cling on to and I would maybe say get I don't think defensive is the right word, but kind of be like, look, this worked for that person. Why isn't it working for me? And kind of, looking for answers from you as the physical therapist, if that makes sense.
Yeah, I think that goes back to there are so many things in life that once you find the problem, the answer is the same for everybody. Like, you know what I'm saying? Like if you have the same car and you have the same issue, like once you find that one problem with that one issue, everybody knows like, okay, I know how to fix that thing in that car, or I have an issue with I don't know, my TV or my or something like that. Where if I have the same TV as this person, we know that once you know how to solve this problem. It's the same for everybody.
Yeah.
So there's like so many things in life, or like the same phone or whatever. Like when you have certain things that are more, I guess you could say there isn't as many variables. There aren't as many variables. It's easy for our brains when we're not familiar with how this works, when you don't work with people and humans and biology and physiology and stuff. It's like everything is kind of like you find the issue, it's the same for everybody. Find the issue, it's the same for everybody. However, when you work in this field, it's very obvious that you get people with the exact same, or it seems like the exact same issues, but so many other variables that can contribute to that specific situation that's going to make each situation unique. But I don't think most people are trained to think that way. So they kind of apply their previous experiences from other things that aren't actual human beings to human beings. And that's where they kind of, there's this disconnect of like, well, that guy did this thing and I know that worked for him. Why isn't it working for me? Like there's something else going on here. And not realizing how that all works. So it's a lot of it has to come to like, that's where all the education comes in is like, obviously there's education online that is going to be detrimental to that. They're going to get more into that black and white mindset. And there's also education where when that nuance is provided, people can kind of learn, not obviously not to the extent that somebody who's a movement professional will learn, but they can learn enough. Like I've had clients where we started in that kind of black and white mindset, and as we've worked together, they just brought up stuff to me like, yeah, but this issue's been going on, but you know what? It makes sense because this, and this, or like, you know what? I was not being great with like my recovery, and so I'm like kind of like, wow, like they would have never thought about that several months ago, but they've learned enough that now they are coming up with the answers themselves, and there's less rumination and worry and concern about if they're actually going to get better, and they understand that setbacks happen. It's the same with fitness, right? Like you don't make the progress, you hit a plateau and people start freaking out. But as they learn more, they're like, okay, that happens. Okay, I need to change things up, or I might need to stick at it for longer and not just constantly move to do new things all the time. I actually need to stick with the exercise and be okay with not constantly increasing my weight. and it's okay. You're actually starting to build muscle now. It's not just that neurological adaptation. So um, I think people just as they learn more, it really helps them to start to come up with their answers themselves, and it makes it your job easier as a coach or a physio.
Yeah, definitely. I agree with that because I know, when we're talking about nutrition or training, or when I'm talking about nutrition or training with clients, I think sometimes it kind of sinks in a little bit more when they've come to their own conclusion. Whereas I feel as though
Yeah,
sometimes um, it's kind of rather than reflecting on things, it's just kind of giving another piece of information. And when you're looking at like we are in the age of like there's so much information with AI, Google, like you can literally type in anything and get the answer to anything that you want. So trying to filter through all that information, whereas I feel as though sometimes it's a little bit more powerful when you come to your own conclusion of, okay, it's as though you've kind of like figured it out for yourself and, feel that little bit more um, success or buy-in with it. Would you kind of agree with that?
100%. I feel like when it's almost like you have to you have to kind of be sneaky about teaching people how to reason through things. Like when I say sneaky, I don't mean like you're being malicious or anything, but like you can't just tell people things too in their face where they're going to resist because they don't understand it yet, or they don't understand what you're trying to say, and they feel like you're just trying to preach at them something that they're going to resist more. But if you kind of just like empathize and understand why they feel a certain way, and you let them know that, and then you kind of plant these seeds of things repetitively over time, but in a very nice kind of like not forceful way, then they start to kind of ruminate and think about that. And then you're actually like teaching them how to reason through things. And once they start to reason through things, then it makes it so much easier and it sticks so much better because now it's not just this thing someone's telling them or they're reading, it's their own thoughts kind of working through the process, which is like I always tell people like I want them by the time I'm done working with them, I want them to feel like they are a master in their own condition. So if they had a clone of them, this is why there's a nuance here again. If there's a clone of them, I want them to be able to teach that person who is them 6 months ago or a year ago. I want them to teach that person through the whole. I want them to be able to guide that person through the whole process. But I always tell them like that doesn't mean go tell your friend who you think has the same issue because you don't really know if it's the same issue because you don't have that training. But like if you had a clone of you who was a year younger than you and didn't understand what was going on, you could actually successfully take them through the exact same program I taught you because that way then they know like okay I've actually mastered this issue. Yeah, if there's things that might seem a little weird that we haven't experienced yet, I might need to reach back out to him again, but usually they kind of get to the point where like even if they have little setbacks they can kind of like problem solve because we've been through it before and they already learned. So I
Yeah.
want someone to take more of an active approach and not just like a tell me what to do. That's why one of the things that bugs me the most, and I know people don't mean it, like I'm not like upset with them, but it just bugs me from a coaching perspective is when I ask them a question to help them reflect, and then they go, "Well, you tell me you're the expert," and I go, "No, like use your brain here, because if you don't, you're not. This isn't going to sink in the same way. So I kind of have to keep putting it back on them, and then I will tell them, you can say the wrong answer, I will guide you through it. Like don't be afraid of that. But if you are just expecting me to just kind of like give you everything, it's not going to help your learning process for
Yeah.
whatever you're trying to achieve."
Yeah, definitely. I think the learning part of it is key. And one thing that you said there of, mastering that process of what you've done, I think the key thing there is they've mastered it for them. Whereas I think sometimes the confusion can come in is I'll just stick with a bad back analogies. Yeah, I've had a bad back. Oh, cool. So I went through X amount of weeks and months to be able to do that. Oh, yeah, I can tell my friends or anything from there. Whereas, yeah, I think it's that case of the key thing there, going back to kind of effective and clear communication is you've mastered it for you. So if they hurt their back again, they can go back and be like, okay, so there's no need to panic. I've been through this before. I know how to do this for them rather than like what we've touched on. There's going to be other areas that might be similar, but not the same for that one person. This might be a little bit of
Exactly.
a tangent, but I always feel as though when I'm having conversations like this about people who have had injuries, we've mentioned earlier about they just want an answer. They just want to be out of pain. I always feel that comes across as from somebody who has this is their very first injury as like a beginner. But I'd be interested to hear your thoughts on when we're speaking about that mindset of, they just want to have a look and do this exercise and expect it to fix it straight away. Do you find that from people who are kind of like beginners to working out, training, or sport? Or do you find that, all the way up to, more advanced athletes or people who have been training for a long time, they still have that same response? Or is there kind of a difference in mindset and thought process around injury and how they or how you even communicate to them in terms of their experience level of training or their experience of injuries?
Yeah, I think most of the time, yeah, when there's someone who's like new to training and new to having little niggles or aches and pains or even just muscle soreness, as you know, right? Like sometimes it's like there's just not that experience to know that like, oh, this is just a minor thing or this is a major thing or um I can't just try to this is more of a management process that's going to take might take several months. They just they don't have that experience to know that. Whereas somebody who's like really well trained, who's been through a lot of issues and managed a lot of things on their own, or maybe even with help from a professional, um, they have all these experiences to draw back on and know like, okay, this kind of sucks, but this might take several weeks, this might take several months. And so they can kind of their mindset allows them to not have that turn into a huge detriment to them and their training because they know how to modify things in the gym. They know how to they've been through that enough. I guess you could say on a kind of a little bit of a tangent. Sometimes though, the issue with that is when I work with somebody who's really well trained, they almost think they have it figured out, where it's like they reach out to me, but they're like, well, I know it's just going to be like this. And they're saying things that are completely wrong after I do the exam. I don't want to just like call them out on that, but I'm kind of like, well, I don't really, this issue you had before might have been like that, but this one's a little bit different. So it's like sometimes there can kind of come with like, again, it's good to have that confidence to be able to help yourself, but sometimes the confidence is a little bit off just because, again, if you're somebody who has the experience working with hundreds and thousands of people and also like countless years of like experience and training, you have like your breadth of knowledge is this big, right? And then someone who only maybe had a few, even though they had a lot of experience, maybe it's only in these things and they don't understand all those other things that could contribute there. So I think on a kind of painting with a wide brush, like yes, usually people that are less well trained are going to have more of a problem, or they just want to get rid of the thing. They don't understand that process. So who's more well trained will definitely understand that things can take a lot longer and how to manage things and how to modify their training. But I guess there can always be that detriment sometimes of the person who knows too much, thinks they know more than they actually know, and then sometimes the person who doesn't know enough, they're like an open book and they're like, you know what? Okay, you told me that it's not going to be a quick fix. Okay, like I don't know, I haven't done this before, and those people are really nice to work with because they're like a blank slate. They're open to anything you say. They totally trust you, and that's always nice to work with those people too because there's not this like extra baggage of their previous biases and experiences. They're just kind of like, okay, you tell me, and I will learn from this, but I also am an open book. That's like kind of nice too.
Yeah, absolutely. I think there's, pros and cons for both, or even challenges with both, because yeah, it's kind of their thoughts, their thoughts around it can be the success or failure of actually being able to rehab it, or even what might take only a few weeks might end up taking a little bit longer because of, oh well, I used to do this, or maybe they're a little bit worried about actually doing anything because it's the first injury, or anything like that. So yeah, I thought that was, yeah, a little bit of a tangent, but interesting in terms of experience of the clients that you're working with. And that kind of flows quite nicely into the next bit in terms of, we've spoken there about, initially understanding the injury and looking for the things that's going to be able to help them. But when we're looking at progress in the gym, whether it be, losing weight, you can have a look at the scale, you can have a look at body fat percentage, waist measurements. If you're looking to get stronger, you can do weight on the bar, how many reps you've done at a certain weight. There's ways of tracking that. Whereas sometimes, and again, going back to what we said earlier, they just want to be out of pain. They just want to be able to move, like they were moving before. Whereas depending on the severity of the injury, and we could use countless examples of different injuries and different time frames. But how do you go about kind of tracking progress when it comes to, supporting a client coming back from injury? Because from the list that I've said there in terms of, is it weight on the bar? Is that a variable that you would track? Is it range of movement? How do you make it so that the client feels as though they're making progress? Because sometimes without through the cycle of any injury, there can be frustration of, look, when am I actually going to get better? Am I actually progressing, or am I still in pain? How do you go about communicating that and tracking progress so they feel like they're always kind of like building that momentum of getting back to where they want to be?
Yeah, I think it kind of depends on each situation about what sort of things I try to highlight when they are struggling to see that progress. I mean, sometimes it is as simple as like taking kind of more like very classic objective fitness measurements, like, okay, well, look how many reps you got with the same amount of weight, even though you're in this amount of pain or whatever, or look how much, just in general, how much more loads you are lifting compared to a month ago, or look how flexible you are. We can measure how far you can reach down. Like if you have back pain, like how far can you reach down towards the ground? Sometimes it's very black and white like that. Sometimes though it gets a lot more difficult. What I tell people a lot of times is like, if you had no pain and we are just trying to track your overall fitness and your conditioning, that's a lot easier to track because again, you can just kind of like look at the what you're actually doing and you can like, okay, are you lifting more weight? If you're sprinting, like can you run the same distance in less time? Like it's very easy to kind of conceptualize for most people. Pain gets more complicated because people can, to me, be making very obvious progress, but if they still have their symptoms, it's hard for people and that's the main thing that we're focusing on getting rid of. It's hard for them to see like that they're actually making progress because they're so focused on are my symptoms there or not. And so what I tell people a lot of times is it's not. We shouldn't measure progress by whether you can turn off the light switch of your symptoms. We should break that down into small chunks of, and again, there's a lot of parallels between like fitness world and kind of pain management world where it's like we have to look at things like frequency, volume, duration. You know what I'm saying? So like they might have their symptoms and still feel like they're not making progress with that. But I go, okay. And this is why when I have the initial exam, I try to ask them things like, okay, how much of this activity does it take to bring on your symptoms? Or what's your resting level of symptoms when you're not doing anything? And they give me like a number. I don't really like the number scale very much, but at the same time, like it helps to know like, okay, they told me a 6 out of 10 at rest. That's pretty dang high
Yeah.
for not doing anything. And then how much activity can you tolerate before you have to stop? Or if you can finish an activity or an exercise or whatever, how long do your symptoms last after you finish that? How long are they elevated for? Do they go into the next day? Do they affect how your next workout is? So you have to like once you break these things down, I do that at the beginning of when we first start. But then what happens is they'll forget that. I'm not expecting them to remember that. So then later on, they're like, I don't think I'm making progress. And we're like a month or two or three in, right? And then I go, okay, so what's your resting level of pain now? And I kind of go through the same questions, and then the light bulb starts to go on when I explain to them, well, before you said this, I'm not trying to, and I'm not trying to like a gotcha, but I'm
Yeah.
trying to like explain to them like, okay, you said this, do you remember that? And majority of the time they'll go like, oh yeah, you know what? And then sometimes before I even break everything down, I do that like maybe a couple times, and they start to go, oh, you know what? Now that you're saying that, and I think about it that way, I'm making a lot of progress. so
Yeah.
so because a lot of times people they gauge am I getting better or not as if my pain is completely gone or if it's barely noticeable. And a lot of times, especially when you have like chronic pain issues, um, people will still have pain every day, decently high levels, but their frequency is they don't have it as often. Like it doesn't last, or the duration doesn't last for as long at a time. But like a little flare ups or whatever. It used to last several days. Now it only lasts a day, which to the average person, that's like, that still sucks. But to that person, that's actually huge progress, right? If it normally lasts, a flare up lasts a week and now it only lasts a day, that's a huge difference. It's like a 700% improvement, for like 7 days a week versus one. And so you kind of break it down that way, and you can even give numbers like that, and then people start to realize like, oh, okay, that makes a lot more sense. And so what usually I only have to do that like once, maybe twice when we work together in those specific situations. And then I don't really have to bring it up anymore. And they start to realize like, oh, okay, I am definitely making progress. And we're on the same page. Whereas a lot of times before I bring that up, I will be in the like, oh, they're making progress. Like, look at this. Like, but then they don't realize it until I like kind of break things down for them. And again, I don't blame people for that because they're not trained to think that way.
Yeah.
They're just like, I have this issue that's affecting my life and I just want it gone. And
Yeah.
it's like this, like, is it gone or not? And it's like, no, there's a huge middle area that you need to get through to get to that it's gone, or at least really well managed. And that's the other thing is I have to explain to people too, expectations. Sometimes with certain issues, you can't, sometimes people don't realize, and again, if you're, this is kind of goes back to the whole more well-trained versus less trained issue. If you're somebody who's more trained, you usually kind of know for certain issues, like, okay, I might have to manage this for a while. Like it might be like a little thing that pops up with certain exercises. Like I have a shoulder issue, and I know if I bench really, really heavy, I'm going to go like really low reps. It might kind of flare up a little bit, but I can manage it. Not a big deal. I'm going to keep training. Like I'm not even thinking about it. Whereas some people don't realize, like, they think like, oh, you have an issue and it should be completely gone and never come up ever again. And you need to like explain to people like, okay, a lot of this stuff, like it might be things that pop up every once in a while, but the idea is I want you to feel like you are in control of it. It's not in control of you. Because if you feel like it's in control of you and you have to like, you can't do the things that you want to do, that's where it's a problem. But if you feel like, hey, this is still a thing that I manage, it's in really good shape. But yeah, you know what? It might be something that comes on every once in a while when I do certain activities. I need to be aware of that. And if I can manage it and I know it's not dangerous and I'm not breaking things down, I'm not injuring myself, then I'm going to be okay and I don't need to like be concerned or freak out about that. And
Yeah.
so that is huge to help people reset their expectations of, hey, because and this other thing is I have to explain sometimes when you tell people it's a management issue, they think like, oh, are we not solving the problem then? Are we just managing it? And it's like, no, that's not what we're doing. I'm just letting you know, like realistically, um, the recovery from this is sometimes you have to get to a point where you're doing fine, but there are certain things that can still aggravate it if you push it hard enough or you haven't trained that enough. Like an example for me is I've had a couple meniscus injuries on my left knee. And if I go to a theme park and I'm on my feet all day walking 30,000 steps, I don't do that every day. And I've had this past injury. My knee almost never bothers me now. But I know if I do that, I'm like, I can expect my knee to be a little bit irritated for like the next day or something, or a little achy. But it's like, it doesn't really affect my life very much, but I just know that's going to happen. Or if I go play basketball and I haven't been playing basketball much, but if I go play hard and I'm twisting and pivoting and jumping and landing, like I can expect my knee to be a little bit pissed off.
Yeah.
um, Now, if I trained that repetitively and I always did that, and I can like slowly build up to that, I would expect less because I've trained my body and my tissues to be aware of that. But it's not a priority in my life. So if I go play and I haven't played for a couple months, I try to play a little bit lighter, but I still know it might bother me.
Yeah.
So my
Yeah.
son is here at the window.
I think I think that's interesting because I think, when people have that injury, it's kind of oh no, wait, I can't do that anymore. And it's kind of cutting everything off and be like, right, no, that's it now. Whereas, yes, you can still go back and do those things, but it might be a case of, right, well, if you want to do that more regularly, right, okay, then your body will adapt to that. You just need to make sure that you're putting in the things to be able to do that, as opposed to yeah, few and far between. It's to be expected with that. When we were talking about the progress, and you said about at the start about or we mentioned a little bit earlier about the case of, look, I've got this injury, I want to happen it now, and having that reflection on it and kind of getting that buying from themselves when it comes to making them like forget about it. Is that to kind of make them focus on the process right now, as opposed to when they initially come in, it's like thinking, am I better yet? Am I better yet? Am I better yet? And just kind of make them get just, stuck into, look, I need you to just do these workouts, just do this, do these exercises, add this in before that, and kind of yeah, focus on that process rather than always thinking, right, this is week two. I'm not back to normal yet. Week three, if that kind of makes sense.
So true. Yeah. So it's like I want them to again focus on the process rather than the whatever their outcome goal is. Um, Understanding in the back of their mind that that's still an outcome that they want, but I don't want them to focus on that all the time because again, then it can kind of lead to them feeling down if they don't feel like they're far along as they want to be. So focusing on, okay, trying to set up goals of like, okay, here's like little chunks of goals towards your long-term goal that we need to try to get to. And then like you did, exactly like you said, just trying to focus on that process more, I think is super important. Um, and also reassuring them, like kind of knowing how to read people and know like, okay, they're a little bit like doubting if this is the right process. Sometimes you have to kind of like remind them that like, hey, if I didn't think we were on the right track, I'm not going to just kind of glaze this over. I will tell you if I think that things are a little off. And I've had to have conversations with people where I go like, this isn't really responding how it should, or like, this is kind of like this is kind of like slower than I thought it would be. But I have to be really convicted to say those sort of things, like to really know like this is really something that I'm concerned about. And I would try to explain to them like I will tell you if I'm concerned. I know you're concerned. If I'm not concerned, like take that as a positive thing that like you shouldn't be as concerned. I understand why you're concerned, but like I've seen cases that are similar to yours hundreds of times. Like this is totally normal.
Yeah.
And sometimes you have to have that conversation multiple times because it's still not making sense to them, and you have to kind of just constantly reassure and again, having that rapport where they trust you enough to know, like, okay, if he's saying he's not concerned, maybe I shouldn't be as concerned as I am. Sometimes if you don't
Yeah.
have that rapport yet, they're like, well, I'm still concerned. I don't really care that you're not. So
Yeah.
you have to kind of build enough rapport that they fully trust you. Because like if somebody doesn't trust you enough with how you're training them or whatever, whenever setbacks occur or things that don't feel right to them, it's going to be hard to get through to them and coach them because the trust isn't there. So building that trust and rapport is so huge.
Yeah, and I think in those last few bits that you were saying there, kind of coming full circle, if you like, going from at the start being black and white statements, people just wanting to know, look, what is that one thing that's going to fix there? You've kind of mentioned, being able to explain different things, trying to have them understanding, there are going to be, shades of grey and it isn't going to be as kind of straightforward. But then also, one thing that you said there, and, going back to what we've said about effective communication, you can only really have effective and clear communication once you've built up that rapport and built up that trust. Because I think sometimes, well, not even sometimes, I would say the majority of the time, there is that fear of that injury, and it's kind of, people are asking for help, and I'm sure you've heard stories or had it before where people have maybe not had the best service that they've had, and they're still in pain rather than finding solutions. Going back to your car analogy, if you'd gone to go get your car fixed and then it was broken, or they ended up being more things being wrong with it, of course you're gonna have that little bit of trust issue to be like, oh well, do I really want to go down this route again? Because it's gonna take up time. There's a commitment in there. So yeah, quite a few topics and tangents spoken about there, Caleb, but some really good content and information that people can take away. But the last question that I like to ask, from everything that we've spoken about today and for everyone listening, what would be your take home points or words of wisdom?
Um, I think it kind of goes back to what we've been talking about a lot is like if you are dealing with a nagging pain or injury, I think most people don't realize that a lot of this stuff takes a lot longer than you want it to take to get better from and to feel like you're recovered from. Um, there are cases where it's like a short-term issue or an acute issue that you just started bothering you or something that maybe it only takes a few days or a couple weeks. Um, but I feel like with most people, once it gets past like a week or two, they start to get more worried and like and I think it's a way bigger problem than it actually is. So understand that a lot of times just because it's taken a couple of weeks or more doesn't necessarily mean that it's a huge issue. It could be concerning and that you need to take more time to figure out, but just know that like it doesn't always mean that it's something that's really a problem. And also if you are dealing with something that's taken more than a few weeks to recover from, sometimes it might take several months. And if you don't know, I would encourage you to reach out to somebody to help you with that or help you understand it better because it can ease a lot of your worries and help you understand like what the path forward is going to be. But just I think the huge thing, I probably said this on other podcasts as well, is like just know that things can take a lot longer than you actually realize they will take. And what might seem super concerning to you when somebody tells you this might take 3 months, this might take 6 months, or whatever. To that person, if they don't seem concerned, it's not because they don't care. It's just because to them they're like, okay, that's pretty standard. Like they just know that it's going to take that long, and they're upfront with you about that. And again, if you've never dealt with something like that, it can be very daunting and feel like, oh my goodness, that's a long time. But sometimes it's just how it is.
Yeah.
So
I think it goes to, well, first of all, I thought that was a nice kind of summary of what we've spoken about then, some great words of wisdom there. And I think, it goes back to what you were saying about managing expectations. I think sometimes, if you, I can't remember the phrase, if you um, uh, under under offer and or
over
overachieve. I can't.
deliver,
Yeah, that's it. Yeah,
under offer, over deliver. Yeah.
that's the one. I couldn't remember that. I couldn't remember the phrase of that. That's probably much better because, if you
Mm.
kind of set your stall out and be like, look, it might take this amount of time, at least then, people are going to be like, all right, okay. So this is the amount of time to it. Whereas I think too often, yeah, if it says it's going to be in this time, if people are anything like me, I'm like, well, why isn't it done by this time? You want to see that progress from
Yeah.
there.
Yeah, I try
But
not to tell people too much of a black and white answer of it's going to take this long. I usually try to overshoot a little bit. I'll say, hey, or I'll say best and worst case scenario. At the best case scenario, it could take this long. At the worst, it can take this long. And in my head, I'm thinking it'll probably take about this long, but I'll try to like give them the under and the over, like because I've also told people like, hey, it might take this long and they get better a lot quicker than I thought. So I was like, that could be best case scenario. Worst case could be it could take longer than I think it might take, but that just depends on several variables. And the other thing to people is like, you need to make sure that you're just taking care of yourself overall from a health perspective. It's not just like exercises you do or stretches you do or whatever. Like if your sleep isn't very good, your nutrition's not good, and your hydration's not good, and your stress isn't good, and your mental health isn't good, like that's going to make things a lot harder. If all that stuff is optimized, then it's going to help you heal and recover better because your whole body is in better health. So I think a lot of people overlook that and they just get so focused on the issue that they have. How do I fix this little tiny area? And it's like, okay, like if you broke your arm, like you can still do cardio and help improve blood flow and still optimize your sleep and still well, you're not doing anything to that arm, but obviously there's all those tissues in that blood and those hormones that are being released. It's all helping your immune system. All that stuff's helping you recover. So keep that in mind too.
yeah, absolutely. I think everyone's looking for more complexity, whereas some of the things that you've said there, and I've mentioned this before to people, some of the best thing that is going to be good for your health and recovery are free. Like
Yeah.
go to sleep, sleep enough.
Yeah.
It doesn't have to be anything crazy. Thanks a lot, Caleb, for taking the time to
Yeah.
jump on. Really, really enjoyed chatting with you today. If anyone has
Thanks.
any questions about what we've spoken about today, want to reach out to you or see the content and information that you share, where could people find you or reach out to you?
They can reach out to me on social media. Probably the best would be on Instagram. It's at dr.caleb.burgess. If they want to reach out to me more specifically for like a long message about whatever issue they're dealing with, probably email's better. So it's just Caleb Burgess DPT at Gmail. And there's other places to reach me, but those are probably the best places to reach me.
Awesome. Well, thanks a lot, Caleb, for taking the time to jump on. Like I say, some really, really useful content in there. Really, really enjoyed chatting with you today. Thanks a lot to everyone listening, and I will catch you all at the next episode.